I think there's a big misconception among the people in the community is that, cannabis does not have any adverse events, but we are not against cannabis and we are not promoting cannabis. We just want to do research just to show the public that what can happen if they consume cannabis with the type 1 diabetes, especially in particular. I think that we, in our research, show that, in this people are mostly the daily consumers are having the more problems. And mostly we believe that it's related to the gastric mobility problems, motility problems. So basically the cannabis decreases the gastric motility and triggers, the nausea and vomiting. So in DKA, the diabetes ketoacidosis, your blood sugars go up first, then you get ketosis, then it triggers the GI symptoms such as the nausea and vomiting. But in hyperglycemic ketosis related to cannabis hyperemesis syndrome, which is a part of the cyclic vomiting syndrome, the first thing is triggered by the GI problems. And then you are not able to eat, drink, and you have nausea and vomiting, then that increases your ketosis and your blood sugar. And then the presentations looks like similar. So that's something like the confusing, and sometimes these people are getting a lot of workup in the ER settings, and then, we are just losing a lot of money, and is a Medicare money or additionals that every time there are some frequent flyers are, coming to ER and, getting with the same problems and labeled as a diabetic ketoacidosis. And another common thing that I will be mentioning, in my talk is that we have a new study that is not published yet. So also diabetic gastroparesis is also mistakenly diagnosed. The cannabis hyperemesis syndrome is mistakenly diagnosed as diabetic gastroparesis. And we did a study to differentiate both, because both of these group have the similar symptoms of nausea and vomiting, some GI symptoms. And then we looked at them, and we just developed a risk calculator with the 97% probability that which category you go with the cannabis hyperemesis syndrome versus diabetic gastroparesis. And if you look at some clues in that study is that diabetic gastroparesis people have a longer duration of diabetes. So most of the time we see the diabetic gastroparesis as a cherry on the top, unfortunately, for the diabetic complications. So most people have already retinopathy and nephropathy and neuropathy. So if we see people are mostly young males, according to our study, and without any diabetic complications such as neuropathy, nephropathy, and retinopathy, are presenting only with GI symptoms, with nausea, vomiting, in a cyclic vomiting, especially in the morning, and response to hot shower. And then we should think about the cannabis hyperemesis syndrome before labeling these people as diabetic gastroparesis. Especially, unfortunately, there is another problem is that these people have this nausea and vomiting and GI symptoms. When they have type 1 diabetes, they were referred to the gastroenterologist to do a gastric motility test, and their gastric motility test comes as positive for diabetic gastroparesis, because diabetic gastroparesis tests that we do for motility testing, they are not specific for diabetic gastroparesis only. It just measures the GI motility. So if your GI motility can be, longer or shorter for different reasons. And just the diabetic gastroparesis is just one of the reasons. And the opioids and cannabis can, they cause some gastric motility problems. We should be keep in mind that.